The Vaser Liposuction procedure is a day procedure, which means that the patient comes to the hospital 2 or 3 hours and we finish the procedures. We take care of the patients for roughly 2 hours in the recovery room after the procedures, and then the patient can go home. Now, there are a few very important things that every patient needs to remember. Immediately after the procedure, we will put the patients into compression garments like this vest. This vest helps to compress the skin and preventing the building of the swelling fluid behind the skin during the days and weeks after the procedure. The compression helps to keep the skin nice and tight for a better tightening over the few weeks after the procedure, and also helping to squeeze out the excess fluid. For patients who have the liposuction performed on their tummy, on top of the bodysuit, we will apply a binder. A binder is an elastic band that goes around the tummy, and there is a plastic board to put in between the layers of the elastic band. Why? The reason is that with this board on the tummy, the patient, even sitting down, will maintain the tummy straight and flat for a better skin tightening and maintaining the skin flat, so that eventually the results will look awesome. Otherwise, if the patient doesn't use the board, when we sit down, we tend to relax our muscles and cause curves and lines and foldings in the soft skin. These 2 pieces of compression garments needs to be worn for the first 3 weeks full time, 24 hours, which means day and night apart when the patient takes a shower. The second 3 weeks, the patient needs to wear only the black vest part-time, which means half a day or 12 hours. The patient can choose to wear it either during the day or at night. During the first week after the procedure, the patient will leak some numbing solution out of the incisions in the tummy. When we do the tummy, we will put a couple of small plastic straws, which we call drains, usually at the bottom incisions of the tummy and one in the belly button. These little straws, the drains, will help to leak out the excess fluid, the swelling fluid, faster. Usually they leak for about 4 or 5 days. When they stop leaking, we will take them out during one of the massages. Now, the patient will have to attend a few lymphatic drainage massages, which are very gentle massages that our physios perform in the days after the procedure. Usually we perform 4 or 5 massages during the week, 10 days after the procedure. Those massages are very important because they will help to squeeze out the excess fluid and the swelling that is accumulating behind the skin, and also will help to recover faster. After the procedure, the patient usually feels a little bit sore, mostly in the tummy and a little bit less in the other areas of liposuction, for around 4 or 5 days. Usually the feeling of soreness peaks at about 2-3 days and then quickly goes down. So within 5 days, roughly, all the soreness is gone. We give prescription to the patient for pain medication, antibiotics, nausea medications if they need it, and the patient takes the pain medication, if are needed, during the first few days after the procedure. Within a week, the patient will not need any more pain medication. Immediately after the procedure, when the patient will take the first shower, usually after 48 hours. Before taking the first shower, lie down on the bed, open the garment, wait a few minutes. When you feel okay, sit up, wait a few minutes. If you feel okay, you're not dizzy, you can stand up. When you feel okay, you can step into the shower. Not hot, just cold or lukewarm, at least the first shower. And then after a few days, after the procedure, the blood pressure will stabilize and the patient will feel much better. So it will be possible to open the garments even standing up. But at the beginning, it's very important to take safety precautions, so lying down on the bed, and avoid hot showers.